Welcome back to Curriculum Development for Early Intensive Behavioral Intervention. This is video part 5. And now we're going to cover how to choose an assessment. These are 7 variables to consider when choosing an assessment. And the first one is comprehensive scope. If a given assessment is not comprehensive, then it's important to use multiple assessments until you have assessed all functional domains. That's all comprehensive means, that it assesses all skill domains. Number 2 is to categorize by age. Okay, so this is to facilitate transition into school and promote success in school. Assessment should be appropriate for children ages 6 months or less to the 2nd grade, approximately 8 years old. The items in the assessment should be developmentally sequenced. In other words, for each domain that you're assessing, you start the assessment should start with the simplest skills in that domain and work towards increasingly more complex skills in the similar way that you would teach them. And it's helpful if the assessment relates the results of to age, right? And by doing so, that gives the assessor an idea of how behind the child is. For example, are they 6 months behind? Are they a year behind? Are they 2 years behind developmentally? Next is considers function. So the best assessments lead to the development of an individualized curriculum that is developmentally sequenced and considers not only the topography or form or structure of a skill, but its function. In other words, its effect on the environment. So, in this case, the assessment is focusing on skills as operant behavior. And that's critical because that actually is more aligned with an EIBI approach to assessment and instruction anyways, right? So this is particularly critical for language, and we're going to go through some examples here. So some assessments may list items that assess what's called expressive and receptive language. So expressive language is what the kid can say, and receptive language is what the kid does when they hear language. Now, this approach considers only the structure, not the function of the child's behavior, so the assessment is likely insensitive to deficits in using the behavior adaptively. So what do we mean by that? Well, consider an assessment item that asks, and so this is an item that is in the assessment. It says, the child is able to ask an adult for assistance with using the restroom. Okay. Now, the child may demonstrate the expressive skill of telling her parents when she needs to use the restroom or the bathroom at home. That would be expressive language, which would indicate a positive mark on the assessment. So you would score yes, the child can do that. Right? But it may actually be the case that she requires prompts to ask for assistance, and that she doesn't say so at home when she's, for example, playing video games, or at all in the school or the community, right? So there's actually a generality problem. That is, she'll tell her parents when she needs to use the restroom at home, but not in other settings, such as in the community. That's a generality problem. There's also a strength problem, is that the behavior is not strongly controlled by the naturally occurring EO for using the restroom with assistance. And these problems would go undetected by the assessment. Okay, so an assessment that doesn't address or doesn't focus on behavior as operant behavior, or doesn't focus on the function of the behavior, is likely to be insensitive to these subtle differences. And these are actually the most important aspects of the behavior, right? It's not enough. It doesn't matter if the child's able to ask an adult for assistance with using the restroom if they don't do it in enough settings to meet the child's needs, and if they aren't able to do it without prompts consistently. So here's an example from the Vineland Adaptive Behavior Scales 3rd edition. Okay, so this is an example of a comprehensive assessment of adaptive behavior. It has multiple domains that are sequenced by age in each domain, essentially. And well, the example I'm going to give you is from the communication domain. And within the communication domain, there's receptive and expressive communication. We're going to look at the receptive subdomain, item number 7. And the item is understands the meaning of no. So that's what you'd be collecting data on in the assessment, is whether the child understands the meaning of no. Well, what exactly the child would be doing to demonstrate understanding no is unclear. It's subjective, it's left open to interpretation. And so it's much more useful to ask about the function of the word no for that child's behavior, right? Such as when the child is told no in response to a request for food, do they acknowledge what you said and find something else to do? That's far more specific, and that's going to give you much more relevant information that'll help you pinpoint what to teach. Or when given pictures of objects or places and asked yes/no questions, do they answer questions correctly using the word no? Right? So these are different behaviors here, different skills. And so if you're interviewing someone with this assessment and you ask them, hey, does your son or daughter understand the meaning of no? Well, they could answer any number of variety of ways depending on which of these events they've encountered or they're thinking about. Or if the child asks things like, is that a horse? But it's a cow, so you say no. Do they ask for additional information, cry, or change the topic? Right? That's much more useful information about the child understanding the meaning of no. If asked, what is the opposite of yes? Does the child consistently give the answer no? No, that's a different skill than the others that we've talked about. Or does the child say the word no to discontinue non-preferred activities consistently? That's also a different use or, quote, understanding of the meaning of no. If the child were being inflicted harm, would they say no to stop it? Well, that's another different use. If shown the printed word no, could they read it out loud? Hey, so all these are a variety of behaviors with different functions. And the more of these things that a child can do, the more we would say they understand the meaning of no. All right. So, but if the only question you're asking is of the respondent is, hey, does the child understand the meaning of no? Well, as you can see, there can be a lot of variability in the information on which that person bases their answer to the question, and it leaves all of these skills potentially unaddressed. Lastly, if offered assistance, do they say no thank you? Or if you say no, can they imitate saying no as well? So an example of an assessment tool, which is great to pair with the Vineland, by the way, and is commonly done so in practice, which also considers the function of verbal behavior, is the Verbal Behavior Milestones Assessment and Placement Program, so VB-MAP. This is a really prominent and really popular assessment tool. This assessment asks very specific details about the child's verbal repertoire, man's text and verbs, across a variety of contexts. For example, here's an item from page 53. It says, selects the correct item in a book, picture, scene, or natural environment when named for 250 items, either tested or from an accumulated list of known words that someone else has put together based on their experience with the child. Or spontaneously manage to peers to participate in games, social play, etc. 2 times. That is 2 times during an observation. So for example, they say things like, come on you guys, or let's dig a hole. Alright, so those are examples of items you would find in an assessment tool that considers the function of verbal behavior. One of those, an example of an assessment tool like that is the VB-MAP. Number 4, links to lessons. Now, an assessment that provides only scores or quotients within skill domains, not linked to specific lesson plans, is of limited use, or at least we can say is of less use than assessments that are linked to lesson plans or curriculum. So ultimately, you will need to link the results of an assessment to a curriculum, so an assessment that does both is most useful. And so The peak relational training system, evidence-based autism assessment and treatment direct training module, is a nice example of an assessment linked to curriculum and specific lessons. Here's an example on, and we're going to take a look at this example more in the next slides. It's number 6B, greetings and farewells, is kind of like the category. And when presented with a greeting or farewell from another person, the participant will respond appropriately. Okay, so there's an example of an item where once you assessment, there are guidelines for there is a corresponding lesson plan. We'll take a look at that. So the peak relational training system uses something called a performance matrix triangle. And in general, you would use this triangle to track progress by highlighting with different colors each time you assess the child's skills. And in general, skill complexity increases as you move down the triangle. Right? And each item, for example 1A, 1B, 2A, 2B, and so forth, is linked to a lesson plan or curriculum program in the manual. So if we look further, here are items from the assessment portion of this manual. The first one here says 6B. That's the greetings and farewells. So that's the same item that it's kind of hard to see there, but that's this item right here. When presented with a greeting or farewell from another person, the participant will respond appropriately. And so you would you would collect data indicating whether they can use the skill or whether their ability to use the skill is unknown. All right, and then based on the results of your assessment, you decide whether you'll need to teach it. And here's an example of a lesson plan that is linked to that item. So let's say it turns out you record no, they're unable to do it, and so you're going to teach 6B. Right? So you would flip through the manual to the program instruction sheet that pertains to greetings and farewells 6B. Right? And so they specify a goal for you. When presented with a greeting or farewell from another person, the participant will respond appropriately. It's indicating there aren't any specific materials needed. An instruction for caregivers will be when another person enters the room, have that person greet the participant, or when another person leaves the room, have that person say goodbye to the participant. Now, what's not being specified here is how to teach it, right? This is just what to teach, including the stimuli. So they're giving some examples. So typical stimuli you would use to teach this goal are familiar people, SDs such as telling the child hello, hi, hey, good morning, and other stimuli that you would incorporate into the program. See you later, goodbye, and bye. And then here is, in this table, are spaces to write the stimuli that you would be using, i.e. antecedents and consequences you would include in the lesson plan. Alright, now number 5 is identify strengths and weaknesses. Another variable to consider when selecting an assessment. Another one is, and so we're talking about the strengths and weaknesses of the child, so not focusing not just on their weaknesses or where they need help, but also their strengths. But also number 6 here tracks progress. Now it's critical to be able to repeatedly assess the child's skills in each domain to determine if progress is being made, and if so, how much and how quickly. And so so that means if you're going to repeatedly assess a child's skills, administration needs to be quick. So short administration time. It needs to be easy to do and inexpensive if the practitioner is going to use it repeatedly. Number 7 is a flexible measurement method. So the assessment should allow for both indirect, meaning you can ask someone about the child's skills, or direct, meaning you can observe the skill. Methods. So assessment should allow for both indirect and direct methods. Now assessment should include direct assessment methods within a behavioral framework when the behavior in the setting permits it. So in other words, whenever possible, like I've said before, always use direct assessment methods. But of course you have limited time and resources, so you want your assessment instrument to have flexible measurement methods, to be able to use indirect assessment when needed. So some situations, direct observation may be impossible or impractical. It may not be possible or practical to assess a child's tact repertoire for 250 tacts. I can tell you in all my years, I have never conducted an assessment of a child's tact across 250 tacts. There's never time or resources for that. So, or at least I should say not directly. Okay, so you're going to have to combine indirect and direct assessment to achieve that. Some skills cannot be observed because they may have occurred earlier in the child's development. So, in other words, the skill of picking up food with the thumb and forefinger, it's very unlikely that you're going to assess that for a 7-year-old. Right? Imitates vowels and consonants. That's most likely to be directly assessed for a very young child. Right? So, anyway, so these skills that may have occurred earlier in the child's development but have been replaced with more complex skills, you might not observe those. You would skip those. You wouldn't try to directly assess those things because the child's moved on to, their repertoire is expanded and includes more complex behavior now. Okay, such as using utensils or answering WH questions like who, when, where. Now, direct assessment results are very often more accurate and reliable than the results of indirect assessment. That's we've said that many times now, so that should be very clear. So, advantages of indirect assessment. There are some advantages. One is that they're easy to implement. All you do is ask somebody about it, and so administration time is much less. Now, some disadvantages of indirect assessment, again, are reliability and validity are questionable. Response may interpret the questions differently, so variability in data may be due to the respondent's learning history and not reflect the child's actual behavior. Alright, so those are 7 variables to consider when choosing an assessment. And according to Gold et al. In 2011, their review of a variety of empirically supported assessments for developing early intensive behavioral intervention curricula include the following here. These are assessments they identified that meet the most criteria, okay, that we've covered so far. So you have the verbal behavior milestones, assessment placement program, EIBI map, the Vineland, also the Brigance diagnostic inventory of early development, Brigance comprehensive inventory of basic skills revised, assessment of basic language and learning skills revised, and then Skills, which was developed by the Center for Autism and Related Disorders, or CARD, one of the largest ABA agencies in the world. Alright, so if you, in early intensive behavioral intervention, if you're drawing from these assessments, then you're probably doing pretty good. Alright, let's go to some ASRs. So the first ASR here, comprehensive in scope, is A, a feature of effective EIBI, B, a variable to consider when selecting an assessment, or C, a domain of functioning. A couple more seconds. Alright, I'll go ahead and close the poll. The answer is B, a variable to consider when selecting an assessment. Next ASR, treatment intensity is A, a feature of effective EIBI, B, a variable to consider when selecting an assessment, or C, a domain of functioning. A couple more seconds. Alright, I'll close the poll. The answer is A, a feature of effective EIBI. Next ASR, has links to lessons. Is A, a feature of effective EIBI, B, a variable to consider when selecting an assessment, or C, a domain of functioning. A couple more seconds. Alright, I'll close the poll, and the answer is B, a variable to consider when selecting an assessment. Next ASR, considers function. Is A, a feature of effective EIBI, B, a variable to consider when selecting an assessment, or C, a domain of functioning. A couple more seconds. I'll close the poll, and the answer is B, a variable to consider when selecting an assessment. Next ASR, quality supervision is A, a feature of effective EIBI, B, a variable to consider when selecting an assessment, or C, a domain of functioning. A couple more seconds. Alright, I'll close the poll, and the answer is A, a feature of effective EIBI. Next ASR, academic is A, a feature of effective EIBI, B, a variable to consider when selecting an assessment, or C, a domain of functioning. A couple more seconds. Alright, I'll close the poll, and the answer is C, domain of functioning. Alright, that wraps up this video part. I'll see you in the next video part when we talk about the second step for linking assessment results to a curriculum, which is conducting the assessment. And from there, we'll proceed directly to deciding what to teach.